I surf. I'm a longboard surfer. When I catch that first wave when I've been away from it for months and stand up on the board, I'm 17 again, and it's magic. That's what I feel every time I do a kidney transplant. I'm John Berry. Currently, I'm a professor of urology and active emeritus professor in the Department of Surgery, Division of Abdominal Organ Transplantation. I finished my residency here in 1973, joined the faculty the next day, and I've been here ever since.
We keep working at it, and when we find something new, we may make an incremental advancement, and then something else comes up. For me, that's the driver, right? It's no matter what we do, we can't seem to finish. We're always running, and we're always trying to better the malignancy. My name is Bill Chang. I received my medical degree and my PhD in neuroscience in 2000 from OHSU. I did my pediatric residency here at OHSU, finished in 2003. Did a pediatric hem-onc fellowship until 2006, and then joined the faculty in 2006 and have been here since.
Having now the opportunity to serve on the faculty of other medical schools and in many, many venues here in the United States and around the world, I really have come to value deeply the training that I received here at OHSU. I think we had some of the best ideas in training medical students here. So I'm Robert Waugh. I'm a 1983 graduate of the School of Medicine. I'm a reproductive endocrinologist from McLean, Virginia. As the 169th president of the American Medical Association, I also was the first Chinese American in a 170-year history of the American Medical Association to be president.
My first job was the Department of Family Medicine contracted me out to Clackamas County Public Health Department, and I kind of had this first view into the obstacles that folks faced in trying to get care, which really led me to pursue research training and led me down this path. And so that was probably one of the formative experiences that kind of led me here, understanding really what interferes with folks getting the best health care and how we can provide it better. My name's John Heintzman. I'm a family physician. I've worked in the Department of Family Medicine here at OHSU since 2005. I did my family medicine residency here at OHSU in 2005, and I also got my master's in clinical research in 2014. Did I finish? I think I did. I had to look back, but 2014 is when I finished my OHSU master's in clinical research.
I've been working in health information technology for about 20 years, and I tell everybody I'm not a technology guy. I don't write code on the weekends. I don't have a computer science degree. I'm simply a physician that wants to use technology to take better care of my patients. In the military, we had order entry, where you could enter your prescriptions digitally in the 1990s. So for almost 30 years, I haven't written a prescription on a piece of paper in a military facility. Every time I write a prescription in Bethesda Walter Reed, I hit enter. Within 2 seconds, it goes and checks a real-time database of all the prescriptions of 10 million patients and tells me immediately if the prescription I just entered conflicts with a medication the patient's already on, an allergy they have, or if it's a duplicate of something they've already had previously ordered. We've eliminated hundreds of thousands of errors because of that system, just that part of the system.
I was lucky because most of the ideas that I had didn't require anybody to spend any money to develop them. We just did them, and they worked out. There have been several technical advances we've made in the actual operation itself. There have been some tubes and things that we've developed that have been applied in urology. So it's just been a good place to be.
My hope in the next 5-10 years for our field is to be at a point where we can actually offer our patients the same medications that the adults are finding now. There are huge advances in terms of new drugs to target different pathways in adult malignancies. Those drugs are still very difficult to obtain for pediatric patients. There's a delay. And so what I hope is that we get to a point where there is no longer this delay, and we can actually offer these new novel medications at the same time as adults are offered these medications.
We do need to understand how the policies, like immigration policy or other policies, do affect people's health, environmental policy, those kinds of things. But my research largely focuses on the end results of those policies and how they affect people's health.
I chose medicine, I think, as a career because I was very interested in the sciences. I was a chemistry major in undergraduate, and so I was very interested in the mechanism of action.
We had a patient, they should have responded to the therapies that we thought they should have responded to, and yet they didn't. Why didn't they? What was it about their malignancy that made it so resistant? And that kind of started the whole real drive clinically to try and find ways to target their resistance.
As a family medicine physician, one of the hallmarks of our discipline is continuity, that you would know people over time. That's been the mainstay approach to make sure that my patients and patients in general get a continuous relationship with a primary care physician that they can know and trust.
The first transplant I was involved with in Oregon was 1969. I have the privilege of being the one who gets to sew it in with an assistant. But there's an entire herd of people who made this possible. When we did number 2500, I had as many of the team members as possible gathered around me at one of our conferences and take a picture. And there must be 20 people in that photograph just to help this one patient and to help me do what I needed to do on that particular day.
Be the doctor that other doctors want to refer their families to. If you achieve that status, you are an accomplished physician. If you have that solid platform of an accomplished clinician, you can launch the most risky proposition. I'm a good example of somebody who has found an interest outside of medicine, technology, where I was able to pivot from full-time clinical time to then work not just with clinical patient care, but also developing technology that can help myself and my fellow physicians take better care of patients using technology.
I'm not a very serious person when I'm on service. I try not to be because it's a very serious role that we play, and that's not what I want to convey to our patients. I hope that the residents learn that you don't have to be serious, you don't have to be grim, especially on the PT MOG floor, and to try and have as much fun as possible during the time that they're on.
Have I done anything for OHSU? Well, perhaps.